of the condition called hypertension and sugar diabetes. Of this Project 10M, Lagos has been allocated a quota of identifying 800,000 Lagos citizens and residents between the same period to measure their blood pressure and their blood sugar. The objective is to increase awareness about hypertension, or commonly known as blood pressure, and diabetes, or commonly known as blood sugar, and also to encourage a positive health-seeking behavior amongst our citizens in Lagos. Let me tell you about the triplets, the three very closely related siblings. Let me introduce you to sugar diabetes, obesity, and blood pressure. They are related. They may seem harmless, but each of them can quietly and slowly have a devastating effect on your health. And there we have Mrs. Sugar, a calm and unassuming sugar diabetes disease often sneaks in very quietly. With too much unused sugar in your system and in your blood, she silently starts to affect your organs like your heart, your eyes, your kidneys, slowly and gradually over time. Mr. Obesity, the food tank that is always full and unused. The big sibling of the trio, obesity, comes across as an easygoing but brings a heavy impact on your body. It is a reminder of how lifestyle choices can slowly increase body fat, body weight, and affect your overall health and strain your organs like your heart, your liver, and invite in his cousin, sugar diabetes. Then we have Mr. Pressure. Hypertension is very often undetected until it is too late. Commissioner for Information and Strategy just described it. If we're not paying attention to our very busy schedules and we're constantly under pressure, there is a risk that we may be making ourselves vulnerable to high blood pressure. Elevated blood pressure that is continuous will quietly and silently stress your blood vessels and organs and increase risk of heart disease and brain stroke. Let us talk about the amount of blood pressure and blood sugar and obesity in Lagos. And this is extrapolated from scientific data. Research has been done to try to understand how much of this disease do we have in our environment. And we're just using this to compare to COVID, because hypertension, diabetes, and obesity is a different kind of pandemic. COVID shook the world, but look at the data. COVID caused 18 million deaths globally in 2020, but hypertension is responsible for 10 million deaths every year. It is just as bad, and it is continuous. COVID has come and COVID has gone, but we're still left with this silent pandemic that is affecting our citizens. Now let's go to Lagos. Our research shows that 30% of Lagosians have hypertension. It means there are 8,600,000 Lagosians walking around every day with high blood pressure. With overweight or obesity, a prevalence rate of 12% means that there are close to 3.5 million Lagosians who have the condition we describe as obesity. And for diabetes, we have close to 1,700,000 Lagosians with sugar diabetes. So these numbers are significant. Next slide. What should we know about these silent killers? They're not communicable. It is not a communicable disease. It affects male and female equally. Most people that have these conditions do not know that they have it, except obesity, which is obvious. It is very common in Nigeria and in Lagos. It is possible to have both hypertension, diabetes, and often obesity at the same time. It is the leading cause of heart disease and stroke and kidney failure all over the world. It can be prevented and it can be treated. So it is not a death sentence. What is important is that you identify yourself as being a hypertensive or a diabetic and you seek appropriate medical treatment. These are some of the complications of diabetes, and they are very similar to hypertension: heart attack, lack of blood supply to your limbs, eye disease, cataract, glaucoma, kidney disease, and all kinds of nerve damage as a result of too much sugar floating around in your blood and in your system. What are the risk factors for sugar diabetes and blood pressure? If you're overweight, and this is a fact that we call the BMI, your body mass index, if it is over 30, and your doctor, when you go for your checkup, your doctor will calculate this based on your height and your weight. If it is above 30, then it is a risk factor for diabetes and blood pressure. Lack of physical activity, a sedentary lifestyle, allows you to put on weight and doesn't allow you to burn your sugar that you've accumulated from eating. An unhealthy diet, diets that are high in sugar, high in salt, processed food, are able to contribute to high blood pressure and diabetes. And of course, a family history. If you're aware that your parents, one or two of your parents has sugar or pressure, or your grandmother or your uncle or your grandfather or your siblings, then it is likely that you have inherited some genes that contribute to these two conditions. Other risk factors are, as you get older, you're more prone to developing hypertension and diabetes. If you smoke, you are at a very high risk of vascular disease, heart disease, promoting hypertension and diabetes. And of course, stress. Chronic stress will lead to an unhealthy lifestyle. It makes you overeat. It makes you resort to alcohol. It makes you resort to smoking, and all of these contribute to this condition. stress, the pressure cooker. Meet our Miss Fumi, a busy professional, juggling work, family, and personal life. Each day feels like a race against time, and the stress builds up like steam inside the pressure cooker. To cope, Fumi turns to snacks for comfort, reaching for sugary treats and salty chips. This cycle of stress and unhealthy eating leads to weight gain, and Fumi soon finds herself feeling tired and anxious. Her blood pressure starts to rise, her heart rate starts to rise, her body's ability to manage her blood sugar starts to fail, and sugar diabetes sets in. So what are the symptoms of sugar diabetes? How do you know you have it? Well, as I said before, you will not know for a while until it starts to become serious, which is why it is important for you to have regular checkups. When it starts getting serious, these are the things that you will start to experience. Frequent desire to pass urine. You are always thirsty. You feel extremely tired for no reason. You have blurred vision. If you have an injury, it takes a long time to heal because high sugar in your blood doesn't allow your body to respond to healing. And you start to lose weight for no reason. Symptoms of high blood pressure. Again, silent most of the time until it becomes serious. Then you start to feel things like headache, dizziness, blurred vision, shortness of breath, and chest pain. How do you diagnose diabetes, hypertension, and obesity? These are silent pandemics. Don't wait to feel the symptoms. A regular annual checkup at any primary healthcare center or any of our general hospitals, or your private doctors in any of the private hospitals in Lagos or near your home or your office, will include a check on your blood pressure and your sugar. If you belong to Ilera Eco, Lagos State's insurance, social health insurance scheme, and you have an active membership, this is free of charge to you at any time that you want at your allocated center. If you're worried about the cost, embrace insurance. For just 15,000 naira per year for one individual, you can access sugar and blood pressure screening amongst many other things, as well as consultations and lifestyle advice as many times as you wish throughout the year. For just 15,000 naira, this is a subsidized rate to Lagosians to keep you healthy and to give you the opportunity to have regular checkups at your assigned medical facilities. So be a conqueror. Know your numbers and control your numbers. A healthy lifestyle is all you need to defeat these silent killers of sugar, obesity, and pressure. Eat a balanced diet. Fill your plate with vegetables, whole grains. Reduce the amount of sugar you consume. Reduce the amount of salt you consume. Reduce the amount of calories you consume every day, and processed meals. Stay physically active. Instead of using the lift, use the stairs. Walk. Aim for 30 minutes of exercise every day, like walking or jogging and cycling, or any sports that you choose. Encourage this amongst your family members, your siblings, your parents, your friends. Try and cultivate a lifestyle of healthy eating and exercise and rest. Maintain a healthy weight. Your weight compared to your height will give you a BMI, and your BMI should be ideally below 25. And we always see very sugary drinks all over the place. Avoid sugary drinks. There are more ways to control your numbers. If you are a smoker, the Ministry of Health today advises you to quit. Stop smoking. Because by stopping smoking, it improves your blood circulation, reduces your risk of heart disease, which is linked to both hypertension and diabetes. Manage your stress. Practice stress-reducing activities like meditation, exercise, deep breathing, and to prevent increase in blood pressure and blood sugar. If you drink, drink moderately. If you don't drink, don't start drinking. Keep alcohol intake to a social volume quantity. Get regular health screening. Monitor your blood sugar, your blood pressure, and your cholesterol levels regularly, at least yearly. Early detection can prevent your complications of hypertension and diabetes. So know your numbers and control your numbers. The 10 Million Project movement, be a part of it. Together, let us spread the news. I told you that almost close to half of all Lagosians have high blood pressure. So that means in this room, a significant number of us have high blood pressure. And let me admit that I am one of them. And I'm sure my Commissioner for Information also has high blood pressure. And he admitted it. But there is not stigma. I take my medication every morning. And I watch my diet, and I try to do physical activity. And I try to stop everyone from stressing my life. That, as you know, is an impossible task in this position. Go to your doctor this month and get tested. And your we have 3,000 private healthcare facilities in Lagos. They're everywhere. They're near your home, they're near your office. Just pop in and say you want a medical checkup to check particularly for sugar and blood pressure. Or visit any of our 300 primary healthcare centers and 30 general hospitals close to you to get a gift from Mr. Governor. From the 28th of October to the 3rd of November, your consultation and your measurement of blood pressure and glucose, your blood glucose, is going to be absolutely free. All you have to do is walk into our facilities and tell them you've come to check your sugar, your pressure, and your weight. I would like to use this opportunity to express our sincere gratitude to the chairman of the Nigeria's Governors Forum, His Excellency Abdurrahman Abdurrazak, the governor of Kwara State, and the chairman of the Nigerian Commissioners for Health Forum, Dr. Banji Filani, the Commissioner for Health for Ekiti State, for driving this critical public health awareness program across Nigeria to start on Monday, simultaneously across all states. Know your numbers, control your numbers. Brought to Lagos citizens, courtesy of our governor, Mr. Babajide Sanwo-Olu, and our deputy governor, Dr. Femi Hamzat. Thank you very much. Drinking alcohol, sugar, salt, stress. You know, it's all about moderation and counteracting your stressors or your risk factors. So if you drink alcohol, for example, and the gentleman said he drinks 3 times a week. So you don't drink to the point where you first of all start to lose control, which brings in other risks, because maybe then you try and drive home or you get into some kind of arguments. So anything that's going to change the way your brain is functioning, like alcohol, you should consume it in moderation. Of course, you know, it has high calories, which contributes to the sugar. And alcohol also is known to damage your heart, to damage the kidney, to damage the brain. So when you add the high calorie to the toxic effect of alcohol, which is also called ethanol, then combined, they can cause significant injury to your organs. But if you consume things in moderation, and there is some evidence that a small amount of alcohol is, you take the car to the fuel station and you keep filling it. And unlike a car, a human being has excessive fuel tanks. A car, you can only fill your tank up to a certain limit. But can you imagine if your whole car had tanks around it? It would just start getting bigger and bigger and bigger. And you're not driving the car. So the same thing for a human being. If you like eating, then burn it. Go and do regular exercise. Instead of driving, walk, go to develop a hobby, play golf like my colleague here regularly, and burn off your excess sugar. Watch the amount of salt in your diet. As Nigerians, we like too much salt. And your palate starts to get used to very salty food, and you keep adding salt, and you keep adding salt. And then you add things like Ajinomoto and Maggi cubes and everything, and all of them have salt in it. So consciously, at home, wives, your people who cook for you, advise them to reduce the salt. It's beneficial to you, it's beneficial to your family and your children. You don't want your children to grow up feeling that they need salt all the time. Avoid your kids drinking sugar and eating sweets. You are already setting them up for sugar diabetes at a very early age. So those are the risk factors. They're very simple, and it is all boils down to healthy lifestyles of moderate, good balanced diet, exercise, rest, recreation, avoidance of certain products that you know are harmful to you. Get enough rest and avoid stressors. We've said that we're going to provide free testing and consultation across our 300 primary healthcare facilities and our 30 general hospitals for the period of the 28th of this month, from Monday to the 3rd of November. So take advantage of it. And in front of us here, sitting amongst us, are the permanent secretaries of the district primary healthcare facilities, and they and their staff will be monitoring that Mr. Governor's instruction, and by extension Mr. President, through the chairman of the Nigerian Governors Forum, who this mandate is coming down to us because we want to start to promote a healthy lifestyle amongst our citizens, avoiding these serious conditions. Can you imagine living with hypertension and diabetes and you don't know it until you develop a stroke and half of your body is paralyzed for the rest of your life? The consequences of that to you, the consequences to your family, the consequences to the health sector, because we have to keep you in hospital for weeks. We have to rehabilitate you simply because you didn't take the time to go and have a checkup at least once a year to know if you have sugar or if you have pressure. It is so simple. It takes 10 minutes. So we are going to be monitoring at these sites to make sure that we follow the instructions of Mr. Governor. He's been very generous to provide a lot of money to make sure that our citizens can access free testing of blood sugar and sugar diabetes for this period of about 1 week. And yes, our quota for Lagos is 800,000, because for Nigeria altogether it is 10 million. And when you divide the population of Lagos by the population of Nigeria, and they did the maths, the chairman of the Nigerian Commissioners Health Forum has given me my quota, Dr. Banji Filani, and said, in Lagos, your target is 800,000 people in 1 week. Give them access to free consultations. And it's not about this 1 week. We're going to be coming back to you periodically throughout next week, giving you more information, because we're trying to transform your understanding of the metabolic diseases as we describe them: overweight, diabetes, sugar, and blood pressure. So, Mr. Onwuka, you asked about what will be the strategy to drive people to get this 800,000 Lagosians. You never know, we may get even more than 800,000. And this is the beginning of the strategy, by letting Lagosians know through the fourth realm of the estate. And this is your responsibility now to help government to transmit this information accurately. And Mr. Onwuka admitted that he has hypertension. He looks like a young man to me. Well, looks may be deceiving, but he looks relatively young, and he has high blood pressure. And we thank God that he knows he has high blood pressure, because he could have been living with it for 5 more years and suddenly end up with kidney failure, heart attack, or a stroke, with devastating consequences. Like I said, when COVID came, it shook the world because it was a shock, and it killed a lot of people in a short period of time. But diabetes, hypertension, and obesity are killing us continuously every day in a slow and steady fashion. And it doesn't always kill you, it can damage you to the point where your quality of life is significantly reduced, because you're living with kidney failure and you have to go on dialysis, because you're living with a stroke and you can't move around, you become a liability to yourself and your family, and because you have a heart attack and you can't even walk anymore because your heart is under pressure, that's failing, or you can't see because sugar and hypertension have caused you to have cataracts and eye disease. So we're promoting Ilera Eco as our insurance, and 2 people have asked about it. What is the sustainability? So if you go to a medical facility and you say you want to get a checkup, you're going to be charged a consultation fee, you're going to be charged for the sugar test, you're going to be charged for the examination, and you could end up paying anywhere from 10, 15, 20, 30, 40, depending on where you go. But think about it. Go and collect Ilera Eco, our social health insurance. Today, it is online. All you have to do is Google it, and it will pop up. And the permanent secretary of Ilera Eco is sitting here. For 15,000 naira for you, and you can register your entire family as well with this additional subsidized rate, you get access to this free screening on diabetes and sugar, amongst a whole number of other things. Is available to you at your designated medical facility that is ascribed to you. You go there, just take time out once a year to go and have a medical checkup, looking for sugar, diabetes, for hypertension, check your weight, check your height, and they will test you for other things. They will screen you for the common cancers cervical cancer, what ladies must go and do, their pap smear, breast screening, for men, prostate. These are the things that will keep you living long and healthy. And if you have Ilera Eco, this is accessible to you every year for 15,000 naira. It's not comparable to you paying for medical care out of your pocket. And this is what the government of Lagos State is providing to you at a very subsidized rate, because 15,000 naira is not equivalent to what you would pay if you did not have insurance. Mr. Salawu, you asked about the stress of traffic, and maybe my counterpart, Commissioner for Information and Strategy, will speak to that as well. Lagos State, I'm in the Ministry of Health, but we are all in cabinet, and we know what we're doing to alleviate the stress of transport in Lagos. We're activating the multimodal transportation system. You know about the red line, the blue line. We're activating the purple line, the green line. We're setting up ferries. All kinds of transportation modalities to reduce the pressure. We're fixing the roads, we're widening the lanes, we're fixing congestion roundabouts, just to make sure that you can get from point A to point B in as stress-free and as short a period of time as possible. Mr. Governor is spending a large amount of money to ensure that there is a very sophisticated multimodal transportation system in Lagos State. So you can move from one end of the state to the other like you would have in any modern city in the world without going through stress. Yes, we know that we've had decades of stressful transportation issues, but everybody can testify to the fact that in Lagos State, our transport system is significantly improving through multiple strategies. You talked about herbal drinks or herbal medications. You're absolutely right. What we have is an agency called the Traditional Medicine Board. It is one of our very, very important agencies in the Ministry of Health. And the function of this board is to make sure that we regulate the traditional and complementary medicines that are available to you, and that we accredit the practitioners, and that we accredit their products as well. And we push their products to make sure they all go through NAFDAC accreditation. So it is up to you as citizens. If you do not see a NAFDAC number on a product, do not consume it. Or rather, let me put it another way. If there is no NAFDAC number on the product, consume it at your peril. That is all the Ministry of Health is going to tell you. The government is trying very hard, both at the state level and the federal level, to make sure that we are protecting our citizens through regulatory function. So if you see a product on the market, or you see somebody hawking products in a bottle and there's no label on it, there are all kinds of things inside the bottle, drink it at your own risk. And I assure you, our hospitals are full of people that have consumed this product and their livers and their kidneys have failed, because we don't know what is inside this product. But our responsible traditional medicine practitioners, they know what to do. There are many of their products that are effective. Things like moringa and all these kinds of things, they work. Bitter leaf, we know them. They prepare them, they test them, they measure their quantities, and they have NAFDAC accreditation, and you are at liberty, because you are protected by the state, to consume these products according to the prescription that is written on the bottle. The last question was about sex. Yeah, sex is a form of exercise, no doubt, as far as I know. And it is very relaxing. So it will bring down your pressure for sure. It will consume your sugar. The question was how many times. That is a matter of personal preference, and I will leave it at that. Thank you very much. We are endeavoring to put more and more PHCs in every ward to make sure that a PHC is a stone throw away from your home or your office. Now let me just talk about Ilera Eko again. Because you will remember that about 3 months ago, Mr. Governor released the executive order which mandates that every Lagosian should now have social health insurance as a minimum. You can have social insurance, health insurance, and any other private insurance that you want. But everybody must have Ilera Eko. We haven't started to enforce it. We're just about to start a massive campaign to encourage all our citizens to take up social health insurance at 15,000 naira per person per year. And if you have this social health insurance, then you are covered for most things, common things. And that includes what you just described as, admission to hospital for more advanced tests and care. If you have insurance, then you're covered for the most part. And so when we talk about, what is the future, it's not as if we're just doing 1 week of free testing. We're just doing that to raise the awareness of both a lifestyle that you need to adopt, but also that you need social protection. And social protection is provided by social health insurance. You never know when you're going to need it. And it is always good to have it in your pocket so that it gives you access for yearly medical checkup, free of charge. So if you have Ilera Eko in your pocket, for just 15,000 naira, you can go in and have checkups. And if they find anything wrong with you, then your treatment starts at no cost because it is contained in that package. And for those of our citizens who cannot afford 15,000, and there are some of us who cannot, the Lagos State government is doing two things. First of all, there is an opportunity to pay for Ilera Eko in small tranches every month or every quarter, so that it doesn't stress you or doesn't stress your pocket. But if you can't even afford that, then both the Lagos State government, the federal government, and many, many donors, developmental partners, are providing what we call contribution to the equity fund, which means that if we identify you as somebody who cannot truly afford social health insurance at 15,000 naira a year, the government will pay for you so that you have that social protection. All you have to do is go online and identify with the Ilera Eko website. Now, when we talk about identifying people with sugar or blood pressure, our first reaction is not to give you medication. That would be wrong. That is not good medical practice. The first thing to do is to identify what your risk factors are and address them with advice on lifestyle. And after about a month or 2 or 3, when you keep coming back and we tell you start exercise, reduce weight, avoid sugar, avoid salt, you will find that in many cases your blood pressure and your sugar will correct itself without the need for any medical drug intervention. And this is what we call good medicine. And that is why we have doctors and nurses and pharmacists that will be helping you to navigate your pathway through good lifestyle management. So you asked about what interventions have we been doing to date apart from this. Well, Ilera Eko promoting lifestyle, we do it all the time. This time we're focusing on hypertension and diabetes and obesity. And we will continue to focus on this. But we may leave this and move to other things, but we will come back to it because it is such an important issue and it is so easy to navigate and to treat and to prevent. Our ultimate objective is to prevent. And if we identify it, it's to restore you back to normal without medication. But if it is too far gone, and even at that point, a lifestyle change doesn't correct it, then we will prescribe some medication. Energy drinks. Certain energy drinks are okay because they're like coffee and they're like tea, they're stimulants. It is not good, again, to overindulge in stimulants. So take everything in moderation, just like alcohol and coffee. I wouldn't tell you to stop drinking coffee, but I would tell you don't drink. If you tell me you drink 10 cups of coffee a day, then you're drinking too much coffee, because it's overstimulating your system and it will set you up for hypertension and stress because it makes you nervous. Low blood pressure is not that common. There is pressure that is normal and slightly below. It doesn't generally affect you. In fact, it is desirable that your pressure is low, and it protects you from kidney and brain damage. But if it is too low, then doctors, there are very few cases where doctors will give you some supplements that will help to raise your blood pressure. I'd like to hand the mic over to the special advisor to the governor, who's been very involved in providing free drugs through our medical outreaches and our campaigns. And I'd like her to address some of your comments and to give her own perspectives.
Too long ago, we had what we called Alafia Eco, where we saw over 24,000 citizens in Lagos. So one of the problems we have is that everybody wants government to do everything, but there's what we call personal responsibility. So there's a limit to what we can do. Like now we're making this awareness and letting you know where to go to and what it's all about. It's all well and good, but if people don't take it up, then there's nothing we can do about it. And I'm saying that because Alafia Eco, we actually gave medication. We told people that came that we're going to give free medication, free, for 1 month. What we said was you have the first 2 weeks, and then you come back so that we can check you and give you another 2 weeks free. The PSCs are sitting here. I can tell you, even today, there's some people that have not come. And hypertension is one of the most common ones that we see. It was the highest in both men and women. So it's one thing to offer something free, it's another thing for the person to come and get it. And hopefully we're going to do it again. And that was Mr. Governor, who felt at the time when things were really getting bad, we sat down in the cabinet together and we said, how can we help our people decrease the stress? And one of the areas, apart from food, which was more or less number one, was health. And then there was transport, and then there was education. So the government can do as much as they can do, but the rest is up to us. And talking about stress, we all have, if there's anybody here who doesn't have any stress in his or her life, please let us know what you're doing. But there's work and life balance. You just have to balance it, and it is your choice. If you want to continue drinking, some people drink because they're stressed, and it's wrong. It's not even just hypertension, it's your liver that is affected when you drink too much. Everything is in moderation. And I'm just reiterating what the Honorable Commissioner has stated. So it's up to you. You can blame the traffic, you can blame what's going on at home, but at the end of the day, you are the one that will take control of it. And knowing your numbers will tell you where to start off from. Just know what so if your blood pressure is 120/80, at least you know those are my numbers. If it goes higher than that during your regular check, you will know, you'll be able to tell the doctor, this is not me. I'm usually at this. That is what knowing your numbers is all about. So you go in, it doesn't mean you're sick, it doesn't mean you're ill. Like the commissioner has said, it's not everybody we call them borderline hypertensive. It doesn't mean you're going to go on drugs. It means you're going to change what you're doing that is probably causing your blood pressure to go up and may even go higher. It's actually that simple. It's this awareness that this hypertension can kill. We hear of people just walking down the street and they collapse. We hear of people, even in government, standing there talking and they collapse. We just hear it all the time, and they're young. I know so many 30-something-year-olds that have hypertension and they're on drugs. Trust me. And it doesn't mean because you're slim, you do not have diabetes or that you're not hypertensive. So weight is very important for you to get your BMI less than 25. But you looking slim doesn't necessarily mean, oh no, there's nothing wrong with me, I don't have headaches, all those symptoms. Okay, fine. Go and check what your blood pressure is. Just know those numbers and keep it to yourself, and you know. So when you go and check yourself again, then you realize that, oh, I'm actually okay, and you continue checking yourself regularly. It's also very important to stress out that family inheritance, you can actually inherit blood pressure. Children can have another form of diabetes where they're basically is childhood diabetes type 1. You have to keep an eye. In other words, you have to bring your children also for checks, regular checks when they're babies and they're growing up. And then don't teach them how to drink, how to eat chocolate, sweets, sugary stuff. I have a sweet tooth, but at least it's in moderation. But children get obese, they get used to the taste of sugar, and this unfortunately will continue to their adult life, teenage years, and then they become diabetic or hypertensive. So the whole idea is, please be aware, spread it. Each person here can tell their entire family. That's how it spreads. And your other members of your family will tell other people, and we tell other people, and we tell other people. And that's how the awareness is spread. So thank you very much.
So on a final note, the